We are back at 8:13 to break down what you need to know about some major medical headlines.
Everything. Oh, well, you could say it as well, but everything has some new information to share with you. We'll be talking about Alzheimer's, drugs, to Jenny Craig's comeback here to a dangerous disease on the rise because of mosquitoes.
Here to answer all of our questions, senior medical correspondent Dr. John Torres. Dr. John, good to see you. Let's get right to it. Let's start with this Alzheimer's drug because this sounds like it could be quite the game changer. What's the name of the drug and what do patients and their families need to know?
So it's called Leqembi, and it's a drug that actually got accelerated approval back in January. They had to wait for phase 3 trials to give it full approval, which we think the FDA is going to do today. And it's intended to slow Alzheimer's progression. This is the first drug to be shown to slow the progression. But the important part is it slows down the rate of cognitive decline. It doesn't stop cognitive decline, but slows it down over an 18-month period, 27% reduction in that cognitive decline, which some experts are saying is only a modest reduction. It gives them about 5 months delay of Alzheimer's progression. And it's only for patients with mild or early symptoms of Alzheimer's. And that's why some experts are saying, should we actually be approving this at this point? Should it be useful? It's not a cure. It can't bring back memories, and that's the main thing. And it does have a cost associated with it. It's $26,500 a year is the cost. We do think that CMS, Medicare, Medicaid will be paying for it, but with strict criteria. And so it's going to be fewer people than we think will be using this.
I mean, I think it's north of 6 million folks in this country suffering with Alzheimer's right now. Clinical trials for this drug, were they promising?
The clinical trials were promising, and they look good. And again, it did two things. It reduces the amyloid, which is one of the things we think contributes to Alzheimer's. Not the only thing, but one of the things, those plaques that build up in the brain. And again, it slowed down that rate of cognitive decline. Didn't stop it, but there were some side effects associated with it. Brain swelling and brain bleeding, and about 14% of people had side effects. Some of those were asymptomatic, meaning they didn't show any symptoms, but still, there's that swelling and bleeding that's in there that was of concern. And some experts are saying this could be a game changer. Other experts are saying we're not even sure this should be approved at this point, but now that it is, or it looks like it's going to be, then this is one more step in that direction of finding something that can certainly help out.
FDA expected to approve it later today.
Today.
Okay. That's interesting. All right, another headline we're following this morning. Jenny Craig back, a little different this time after filing for bankruptcy, but this time online only, right?
Right. Jenny Craig filed for bankruptcy in May. And if you remember, it was the stores everywhere.
Sure.
You and I were talking about
decades.
The commercials, Jenny Craig commercials everywhere. Well, it used to be that you would go to the store, you would get your pre-made food, and you would get some coaching, basically, some nutrition coaching. Well, what they're going to do now is it's all going to be mail order, essentially. You're going to be pre-made food through the mail, and it's going to be virtual coaching instead of actual coaching. And some advocates are like, hey, this is great. Jenny Craig's coming back. They love Jenny Craig. There's actually a following, even after the bankruptcy, saying, hey, we want Jenny Craig to come back. And so they think this will be something that will be one more tool they can use in that dieting toolbox we have, along with a lot of other things.
Well, they face some, you said other things, they face some competition with, the popular diet trends like Ozempic. Can you talk really quickly about what people need to know, especially even about that?
Right. And the main thing with Ozempic and those types of drugs you need to know is they work as long as you take them. And we do know that obesity is a disease. And think about it like high cholesterol, high blood pressure. You need to take that medication for life. It's the same here because once you stop taking those medications, the weight bounces back. As a matter of fact, not only does it bounce back, but they did a study. This is for type 2 diabetics a couple of years ago. At the 2-year point, 70% had stopped that medication because of side effects. Didn't want to take it anymore or cost, which, again, they can be expensive and they're usually not paid for. So they're good as long as you use them, but you need to use them along with lifestyle changes, meaning, change your diet, make sure you exercise, all those things. So if you do stop it, then the weight hopefully gets maintained.
Hey, Dr. J, as we've been seeing, obviously it's hot, it's buggy outside. We've been reporting on some of these malaria cases in Texas, Florida as well in the last couple of months. So how concerned should we be about those mosquitoes giving us malaria?
And Peter, you're right. Four in Florida, 1 in Texas. These are what we call localized infections, meaning they're infections from mosquitoes that bit somebody in that state, not coming from out of country. Up until now, 2003 was the last time we had these. The last 20 years, it's been cases that came from other countries. People got bit in another country, came here, and developed malaria.
So this is the first time in 20 years that it's happened in our country.
It's been localized. Exactly. Coming from our country. Still an extremely low risk. And the CDC has put out an alert, but they say it's a low risk. But the thing you need to remember is it is a mosquito-borne disease. And you need to be careful with mosquitoes because it's not just this. We have Zika, we have chikungunya, we have West Nile virus, all these other diseases. Be careful with mosquitoes.
Chikungunya
doesn't sound very good.
It does not sound lovely.
Avoid that. Symptoms, though, to keep an eye out for. What are parents looking for?
So the symptoms, fevers, chills, body aches, fatigue. The main thing is those fevers tend to be cyclical, so they can happen either every day or every other day. Protect yourself from mosquitoes. Bug spray, long sleeves. Don't go out at dusk or dawn when mosquitoes are most active.
Does it matter if you have DEET or no DEET in the spray? Just quick question.
DEET works really well, but there's others that work as well.
Okay, good.
Okay.
Dr. J, thank you.
All right,
Appreciate
you bet.
it.
Thank you.
Dr. John, thank you so much.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.